Chapter 11. Let's chat about health services for special populations. In this PowerPoint, let me figure out how to move this PowerPoint. There we go. Learning objectives are listed here. They're also on page 435 of the book. Continued onto this slide. So, introduction. Certain population groups in the United States face greater challenges than the general population in accessing timely and needed healthcare services. This can be related to so many things. Um, Socioeconomic status, where you live, whether it's rural versus suburban. It there's so many. We'll keep reading. Um, as a consequence, member of these groups greatest risk for poor physical, psychological, and social health. They don't seek medical care. Some of the terms used to describe them are listed here in the PowerPoint: underserved, medically underserved, disadvantaged, underprivileged, underclasses. That's this population. And here's what this population, um, the framework of it is. All these people listed here. The book is full of statistics and so many tables and exhibits. And I want you to keep in mind how old this information is. Still relevant, but this is not the accurate data as of today. So this book was copyrighted in 2019, which means they put it together 2018-ish, which means some of this data could date back as far as 2014. So all of this is also pre-COVID. So these numbers are completely different in today's time, but still the issue remains, and these populations are still special, but the numbers have changed. That was my point, is the numbers have changed. So don't focus on the exact data numbers as much, but just read and review. There's great information in this chapter. Okay, so vulnerabilities, that is discussed on page 436 to 437. Here's another figure. These are the figures I was kind of talking about. So yeah, so here's 2014. So this is very outdated information, but still relevant. Take a look at these charts. Let me know if you have any questions about them. Oh, here's more charts. There's more and more. These are all in the book also. I'm going to skip some of these slides. Okay, racial, ethnic minorities. This is talking about the Asian population. I gotta get caught up in my book. I skipped all those. Yes, so Asian Americans is discussed on page 448. Native American Indians and Alaska Natives are discussed on page 449. Uninsured. This is a huge problem in this country still to this day, and this is not particularly, I know this chapter is talking about underserved, disadvantaged, but there are plenty of uninsured people throughout our nation. The Affordable Care Act made progress, but it didn't cure the issue. And let me say that as we read and review this chapter, in 100 years, another teacher is going to be teaching the same thing. And I think this is still going to exist. There is not an easy fix. There's not a quick fix. Many of the minority groups and the underserved and underprivileged people choose not to go to the doctors or use our healthcare system because of mistrust, because of horrible history to a certain population. There's more than one reason that they don't seek healthcare. Um, but gosh, that's a whole nother topic. Okay. Children are definitely a vulnerable population. I was kind of surprised at just the percentage of children who experience some of these disparities. It shocked me reading through these pages. Children's continued. Women are definitely a high risk group. Given our nation's history, we have come a long way in the past 50, 60 years. But keep in mind, in this century, did I say that right? In this century, yeah, I think I'm right. I'm just going to say it. I might be wrong, but in this century, women could just had the ability to vote. So less than 100 years ago, women could not even vote in this country. So think about that. I'm not saying that it's totally correlated, but I'm just saying women have been a disadvantaged population on many other fronts also. Okay, so rural health, yes, definitely because of supply and locale. That's a huge issue when we live rurally. And also another thing with rural is a lot of people are poverty level and live even below poverty level. When we think rural, we may think farms, we may think um, mom and pop country stores, restaurants that are, not many chain type restaurants. They're the local community, people living and serving their own community. So there's just not a lot of revenue in in rural communities. Um, some there are, but some they are not. Like your rural community may be different than my rural community, but they are underserved areas. Especially when, let me go back to this, especially when the hospital or like a trauma center, let's say a trauma center is more than 10 minutes away. That's a huge underserving. Doesn't mean there's anything wrong with that rural area, but that population is going to be underserved. Migrant workers are a huge classification population of underserved, and the biggest thing with them, well, there's a lot, but the book mentions the developing infectious diseases, and that's because they don't live in the greatest conditions, and they many of them culturally live several people to a house or several people to a home, and if someone gets sick, it spreads rapidly. They don't seek medical care because maybe they're not here on a work visa, maybe they don't want to spend their money, maybe they don't have the money to spend for healthcare, etc. And that could really go across all of these populations. Homelessness is mentioned in 461. Estimated of 22.8% of all homeless people are children, and that blew my mind. I think that's just a high number. And again, this is old information, but that's a lot. Oh, I went past homelessness. I'm still talking about it. So shortage of adequate low-income housing, barriers to health care. Um, Many homeless people choose to be homeless. They don't want to live in housing. They don't want to pay apartment rent. They don't want, it's easier for them. And maybe it's more mentally, what's the word I'm trying to say? In other words, some people, some homeless people do choose, and that's okay, but we still have to serve them. They still have a right to access our healthcare systems and such as that. And many of them don't have a choice. Many of them land in homelessness and do everything they can to get out of it. Um, but we know, especially post COVID and in this housing market that we live in, where's low income housing? They're not building any more of it. They're building mansions and $500,000 homes, and if you can afford that, that is fantastic. But we still have to provide for those that can't. So that's a huge issue right now in America. Okay, mental health. Oh, so many barriers to mental health and healthcare in general. Mental disorders are common psychiatric illnesses affecting adults and present a serious public health problem in the United States. And they don't just affect adults, it affects every human. Mental health can. See table 11.7. Where is that in the book? There is a table 11.6 on 466. There it is. On page 468, there is a um, table of mental health providers. Okay, chronically ill. The chronically ill, these chronic diseases are now the leading cause of death in the United States. We're living longer, but we're not necessarily living healthier. Disability is also recognized as an underserved population if you have a disability. I skipped over that. Chronic illness, yes. Okay. HIV, AIDS. Your book does a great job. It shares so much information about this. Um, and these numbers, again, are old. HIV infections in rural communities, HIV in children. Mothers can pass on HIV to their children. There's a 20% chance that it passes through the placenta, breastfeeding, etc. HIV in women are mentioned in the book. The research, um, it goes page 474 and 475 go in continuing of HIV. 475, it mentions the Ryan White um, Resource Act. Through the Medicaid waiver programs, states may design packages of services specific to populations such as the elderly, disabled, and people who test HIV positive. Mm-hmm. Cost of AIDS, HIV, yes, summary. Is that it? That's it. So, I think I went through that pretty fast. I tried. There's a lot of information in this book. Again, I don't want you to focus on the numbers necessarily. Some of the percentages, the impact is still, I'm sure, with today's numbers would be very similar. Because again, what we're talking about this chapter, there's not a solution to this. We can make some micro changes along the way and help improve this, but I really think um, in decades to come, the next instructors who teach a course like this are going to be saying the same thing, unless somebody comes up with a one size fits all solution and we can help get everybody the healthcare they need. I personally would love to see degrees and providers who focus on prevention more so than treatment, but that's a century away. That is, I don't know that how well that would be received. But that's where we would really get far with is prevention. Anyway, okay, you guys let me know if you have any questions.